Thank you all so much for coming. My name is Ingrid Katz. I'm a physician at Brigham and Women's Hospital. I'm also the Associate Faculty Director of the Harvard Global Health Institute and an Associate Professor at Harvard Medical School. The title of this talk is Leading Through a Time of Transition, Developing a Strategic Plan for the Harvard Global Health Institute. And it really reflects the last year of transition for us at the Harvard Global Health Institute, and I'm eager to share it with you all. As you can see, this year has been a busy one for me. I have been involved in speaking to the media about COVID, particularly during this time, vaccine equity. And I had the great honor of writing a piece with my colleague, Alan Brandt, who's a professor of the history of medicine, and he's also our interim faculty director at the Harvard Global Health Institute. As you can see here, part of our goal this year, both Professor Brandt and myself, was to draft a strategic plan that would be critical for the new faculty director, our permanent faculty director at the Institute when they come on board. This is a plan that we wrote and shared with the Office of the President and Provost of Harvard University to ensure that we have a blueprint going forward as to how we will continue to engage across the university in critical work to achieve our mission and vision. And as you can see, there are really three interrelated pieces of this circle. One is focused on developing interdisciplinary research and training. And part of our goal is to really ensure that we have engaged faculty members who are embedded with us at the Institute so they can continue to do work that may be difficult to do on an individual basis, but that really suits a potential for cross-disciplinary collaboration. Our second piece here is promoting educational opportunities. I had the great fortune of working with Professor Brandt last year to teach a course in the Gen Ed program for the Harvard undergraduates on COVID. And this year, we will be teaching a new course on vaccines. We're fortunate to have Professor Galit Alter, an immunologist, who will be working with us to teach this course. Finally, we want to ensure faculty development. And this is a really critical piece because, again, many of the faculty who are engaged in global health often are working in silos or in very small groups. And our hope is through this collaborative enterprise that we can bring faculty together across disciplines, from the engineering school, the Kennedy School, the business school, to the medical school, the School of Public Health, and on. We're very lucky at Harvard to have such a large community here. And we are hoping that by being situated in this space that we can really bring people together. So some of our early results, we built really from scratch the strategic plan, Professor Brandt and I, and worked through a lot of the challenges that we felt we could learn from over the lifetime of the Institute. The Institute has gone through many different iterations since its insemination over a decade ago. And so we were eager to learn from these things, but also see a pathway forward. So developing a strategic plan was something that I learned to do during this time, and feel so fortunate that I got to work with Professor Brandt on this, who's had tremendous expertise in re-evaluating and reconceptualizing programs. We then sent this on to the president and provost and are happy to see that there is a commitment to continue the Institute moving forward and to invest in this important work. There's also a real recognition, particularly during this time of COVID, how critical global health is and how intertwined these issues are. From the impact of climate change on pandemics to forces such as leadership. We're focused right now on continuing to develop our own leadership program for women in low and middle income countries. And we'll be entering our third year of this cohort and are thrilled to get the opportunity to share it with you all as we move forward. So these are just some of the early results from the work that we did over the course of this year. as you can see, we're continuing to move forward. I'm fortunate to continue to work with a dedicated team here at the Institute, and we see as a critical mission that there's so much work to be done, not just in the space of pandemics as there currently is, but certainly in these other cross-disciplinary areas like climate change and health, like misinformation, like migration and its impact on health. There are so many critical areas right now that really require cross-disciplinary expertise. And so I'm really excited to move forward in this next chapter as we welcome our permanent faculty director here at the Institute. I want to thank the tremendous leadership of the WomenLift program for including me in this marvelous fellowship, and also my deepest gratitude to Professors Brandt, Dr. Kathy Rexroad, our division chief, and my wonderful family.